Friends of the media, good afternoon. Welcome to the press conference of the Joint Prevention and Control Mechanism of the State Council. President Xi has emphasized the importance of stepping up treatment, expand bed capacity, adopt medical intervention as early as possible, so as to ensure treatment at the early stage when it was mild case. Premier Li Keqiang has also emphasized the importance of increasing cure rate. Today we focus on the treatment and recovery of the patients. We have with us Inspector Guo Yanhong from the Medical Administration and Hospital Management of National Health Commission, Director Wang Guiqiang from the Infectious Disease Department of the First Hospital affiliated to Peking University, Director Xie Yuxiao from the Rehabilitation Department of China-Japan Friendly Hospital, Director Guo Na from the Nursing Department of Peking Union Medical College, and Director Physician Wang Rongbing from the Integration of Traditional and Western Medicine Department of Ditan Hospital to take questions. First, some updates on the epidemic. For yesterday, across provinces and Xinjiang Production and Construction Corp, new confirmed cases 427, new deaths 47, including 45 from Hubei province, 1 from Beijing, and 1 from Henan. New suspected cases 248. And on the day, newly cured and discharged from the hospitals 2,885. Those of medical observation 10,193. Severe cases were reduced by 288 on the day. As of 24 o'clock of yesterday, according to data from provinces and Xinjiang Production and Construction Corp, remaining confirmed cases 37,414, including 7,664 severe cases. Cumulatively cured and discharged from hospitals 39,002. Cumulative death 2,835, cumulatively reported confirmed cases 79,251, remaining suspected cases 1,418, cumulatively traced close contacts 658,587, those that are still under medical observation 58,233. In Hubei province, new confirmed cases 423, including 420 from Wuhan, newly cured and discharged from hospitals 2,492, including 1,726 from Wuhan, new deaths 45, including 37 from Wuhan. Remaining confirmed cases 34,715, including 28,836 from Wuhan, including 7,370 severe cases across the province, 6,585 from Wuhan, cumulatively cured and discharged from hospitals 28,895, including 17,572 in Wuhan. Cumulative deaths 2,727, including 2,169 in Wuhan. Cumulatively confirmed cases 66,337, including 48,557 in Wuhan. New suspected cases 159, including 114 in Wuhan. Remaining suspected cases 1,171 across the province, including 788 in Wuhan. From Hong Kong, Macau, and Taiwan, confirmed cases 138, 94 in Hong Kong SAR, 10 in Macau SAR, and 34 in the Taiwan region. Apart from Hubei province, new confirmed cases 4, 1 in each province. And in other provinces and the Xinjiang Production and Construction Corp, there is no new confirmed cases. New suspected cases 89, new deaths 2. Severe cases were reduced by 25. And in cities outside Wuhan in Hubei province, new confirmed cases 3. Across the country, cumulatively discharged cases ratio to deaths expanded to 13.8 to 1. The cure rate has been on consecutive rising. For the next steps, we will continue to focus on patient treatment and the zoned approach to implement early detection, early reporting, early isolation, and early treatment. Pay special attention to the treatment of mild cases and the treatment of severe cases to consolidate the achievements. This is the update. Now we'd like to take questions from the floor. You may ask questions around the theme of today's discussion, and please identify yourself before you ask the question. First question, please. Thank you. With the Xinhua News Agency, according to the data released by National Health Commission, the total of the cured discharged patients have reached 39,002. So I'd like to ask, the treatment of severe cases, and one is the signal for convalescence. Patients' rehabilitation exercises. What are those exercises? I'd like to ask Madam Guo Yanhong from National Health Commission to take the question. Thank you for your question. As you have rightly pointed out, as there are more and more patients cured and discharged from hospitals, timely rehabilitation guidance and health management are essential to improve the full course management and facilitate the rehabilitation of the patients. National Health Commission has proposed close follow-up visits and health management for the recovered patients. To facilitate the rehabilitation of patients, we require classified measures to be adopted on mild cases and severe cases. For mild cases, the recovered patients can take rehabilitation in community or in home environment. For the recovered patients from severe cases, such service should be provided by specialized health institutions. For the technical guidance and requirements, I'd like to ask Director Xie from the Rehabilitation Department of China-Japan Friendly Hospital to give you an answer. Thank you. Respiratory disease rehabilitation needs an array of health management measures. First, we require standardized lung function recovery assessment. Therefore, we emphasize very much individualized and personalized rehabilitation services, including the cardiovascular and lung function exercises, the oxygenated exercises, the strength exercises, and also psychological counseling. And for the novel coronavirus pneumonia, the lung function exercises will improve the stamina of the lungs. It is also beneficial for the patient to recover the functions to be engaged in social activities. Researchers have shown that at the acute stage, if the symptom becomes stabilized, the earlier rehabilitation exercises are involved, the better the prognosis is. However, the disease is under Category A, infectious disease management, and confirmed patients receive the treatment in designated hospitals. So for severe patients and gravely ill patients, our focus is still the saving of life. But for the mild cases and moderate cases, if the disease has been stabilized, the earlier the rehabilitation is, the better the prognosis will be. The specific measures will be tailor-made by localities. Thank you.
Thank you. Let's continue the Q&A. On the right, on the front row, the reporter close to the aisle. Thank you. From Economic Daily, we noticed that there are medical teams traveling to Wuhan to help, and the total number has exceeded 40,000. May I know the proportion of nurses and the role of nurses? Madam Guo, please. Thank you for your question. Indeed, since the outbreak of the epidemic, the healthcare system, especially the medical professionals, have been mobilized to help Wuhan. Throughout the country, we have sent the elite medical teams with a total number of 42,000. Nurses numbered 28,600, representing over 60% of the total. Nurses are playing a very important role. According to an old Chinese saying, for disease treatment, 30% is done by the doctors and the remaining 70% is done by the nurses. So in the makeshift hospitals or in the ICU wards, you can find nurses busy working. Nurses provide tender cares to the patients and carefully monitor the disease progression. Together with the medical doctors, nurses contribute greatly to save the lives, reduce the mortality rate, and increase the treatment rate or cure rate. With their concrete actions, they demonstrate the spirit of love and care, and they are also the most adorable people in the new age. Let's continue on the left, on the second row. Thank you. From the cover, we know that in the Central China Science and Technology University, the autopsy was conducted on 9 death cases. So what's the value of such practices? Dr. Wang, to take your question. Thank you for your question. Indeed, people are watching very closely the results of the anatomy. The epidemic is a brand new disease, and in terms of the pathogen, the tissue problems or the consequences on people's health, there are many outstanding questions. A good piece of news is that there have already been 11 autopsies or anatomies, and these anatomies have reviewed a lot of information concerning the epidemic, especially for clinical treatment. However, as you can see, there are still many outstanding questions, so the pathologists and the clinicians are working closely, and in the light of the clinical symptoms and the developments, the results of the anatomy will be applied on a scientific way. So I'm sure we will get more detailed results published to facilitate clinical treatment. The anatomy, the pathogenic anatomy, is a high-risk practice. Let me express my appreciation to experts and the pathologists involved, and also the clinical doctors who have mobilized the such practices, as well as the passaways and the bereaved families for their contribution. Only by knowing better the disease can we better treat the patients and the disease. Thank you. Let's continue. On the right, on the second row. Thank you. From Chinese Families News. Just now, it has been mentioned that nurses are dispatched to Wuhan or to the epicenter. So how can we protect and ensure the health of the nurses? Dr. Guo, please. Thank you for your question. President Xi Jinping points out that medical professionals are the mainstay against the epidemic. It is of paramount importance to protect their health. Guided by the relevant government agency, we have provided training for medical professionals who are working on the front line. Also, expert teams are dispatched to the frontline hospitals, helping the hospitals to improve capacity in this regard. Also, the medical professionals are trained and equipped with more knowledge about self-protection. Also, for nosocomial infection, relevant experts are working together with the frontline professionals. Up to now, all the medical teams have had their dedicated nosocomial infection prevention teams established to ensure the strict implementation of the technical guidance and the guidance from President Xi as well as the relevant agencies. Let's continue on the right, on the third row, the first reporter there. Thank you. From China Media Group, CCTV. We noticed that in the latest diagnosis and treatment guideline, TCM is highlighted for both diagnosis and treatment. Why is that? And how can the TCM prescriptions or therapies applied? What kind of evidences have supported such inclusion of TCM therapies? Madam Wang Rongbin, to answer your question. Thank you for your questions. Based on our previous efforts, we revised the 5th clinical guideline. Summarizing the previous experience, we found that it is of optimal result to have early intervention, and the early involvement of TCM can help ensure the results of the treatment. Expert teams from the State Administration of TCM were dispatched to the epicenter quite early in the epidemic. The experts have also surveyed and investigated into the various TCM prescriptions and selected the promising therapies. So in this context, the 5th guideline was adjusted and complemented. The added components of the TCM in the 6th guideline mainly include the clinical treatment with TCM therapies. Previously, the treatment was divided into 4 phases, and after the amendment, the TCM approach is consistent with the Western approach.
It is also consistent with the treatment protocol and guideline from National Health Commission to mild cases, moderate cases, and the severe cases. The formula was also expanded. In particular, the general formula for clearing the lungs and changing and correcting the inflammation at the lungs. For severe cases, the TCM injection dosages are also recommended in this updated version. So for the 6th edition, it is more practical and easier to be used. What was your second question? Would you mind repeating that? For those under medical observation, will the TCM compound play a role for prevention? Those who are under medical observation do not show any onset, but according to this protocol, we suggest it to be used for those who have shown certain symptoms like fatigue or diarrhea. Some herbal compounds like huoxiang pills and liquids are recommended, and some feel fever, some fever cleaning or lung inflammation cleaning compounds are recommended. So in general, we do not recommend those without symptom to take the herbal compounds. So for prevention, we still suggest the following of the advice from the State Council, namely the joint prevention control mechanism, and do not go to the epicenters. Wear masks, have a good hand hygiene, protect those who are around us. So these public health interventions for prevention. You have also asked a question on the efficacy of TCM compounds. I'd like to make some brief comments on that. There is wide scale of TCM, and there is the big application of integrated traditional and Western medicine treatment. If we compare those with or without traditional medicine, we can see good efficacy on using traditional Chinese medicines. For example, for mild cases, those with traditional medicines see major symptom improvement like fever, coughs, sore throat, poor digestion, poor appetite. Fever was eliminated very quickly, or the dry coughs also went away quickly, and this has curbed the disease to progress further into a severe case. Since the combination of TCM has reduced the fever intensity, this can also shorten the lasting time of the fever. Apart from changing of the symptoms, respiratory indicators such as the SATs have also seen improvement, reining in the disease from progressing further to gravely ill stage, which also means the reduction in fatality rate. The recommended formula is the second time that it was recommended, which is called 清肺排毒, which means the clearing of the lungs and detoxification in the lungs. It was first piloted, tried in one province. Once proven effective in quickly driving away the fever, it was popularized quickly across 4 other provinces. And on the 26th of January, NHC has given the notice that this should be popularized. Across the province, it can be used for mild, moderate, and severe cases. Even in gravely ill patients who have never been administered the TCM. So it is a general purpose formula. On the 27th of February, it was used in 10 provinces, 66 designated hospitals. Those who are under clinical observation, over 1,388. It was for emergency need. It is pragmatic. That's why we've enrolled 1,000 plus patients. 640 patients have been discharged. 457 patients have seen improvement in symptoms. Therefore, it was re-recommended in the renewed edition. Thank you. Next question, please. Thank you. From Chengdu Red Star News. Most of the medical resources are used on the treatment of the moderate and severe patients. Are there medical resources channeled to rehabilitation stages? Who is to roll out the responsibility? What should be done by community clinics? I'd like to ask Director Xie Yuxiao to take the question. Thank you for the question. On top of existing respiratory disease rehabilitation services, localities have carried out some exploratory trials for rehabilitation services provided to COVID-19 patients. Before patients are discharged from hospitals, patients are assessed for the stamina of their lung and heart functions and for physical checkups. For those who recovered from severe and critically ill stages, we recommend patients go to designated health institutions to get rehabilitation services. For patients who recovered from mild and moderate cases, there are no sequelae effects impacting their lung or heart functions. So we suggest the rehabilitation services and the exercises be done in communities and in family environment. Thank you. Next question, please. Journalist from the third row on the left side. Thank you. From Wenhui Bao, Wenhui News. Since the outbreak of the epidemic, many nursing staff were working at the front line. In particular, the nurses for the severe patients are very much concerned by media and the general public. They have made immense dedication for the treatment of the severe patients. How should you comment the role played by nurses taking care of the severe and critically ill patients? I'd like to ask Director Guo Na from the Nursing Department of PUMC to take the question. Thank you for your concern on nurses taking care of the severe patients. We know for patients as such, they usually develop comorbidities and multi-organ failure. The nursing work is complicated and very of grim challenges. They are required of a high level of skills, and their skills and their care carry important significance for the prognosis of the patients. Given the heavy need in Hubei and in Wuhan, we've sent 5,500 plus nurses for taking care of severe patients, 21% of the total nursing team. And they are 1/3 of the entire medical team taking care of the severe patients. They have to monitor the vital signs, the respiratory circulation of the patients. Meanwhile, they have to manage well the artificial ventilators, ECMO treatment. And for critically ill patients, we have to prevent against the respiratory-related and incubation-related infection or the thrombosis that have been developed from the use of ventilators and incubators. With their treatment and caring, the symptoms of these patients have seen improvement. National Health Commission has worked out the nursing guidelines, and this has been distributed and circulated across localities.
In particular, there are specific technical guidances or guidelines concerning the nursing for the severe and critically ill cases. They have played a very positive role. Thank you. Let's continue. On the right, on the fourth row. Thank you. From Hong Kong China Review. During the epidemic, the normal medical services are affected. So how can the online medical consultation be utilized to avoid the potential cross-infection and public gathering? Madam Guo, thank you for your question. Just as you said, in early February, when the epidemic containment was at a very resource-consuming period, we have made arrangements for medical consultation services to be provided. We request the local authorities to set up provincial online platforms for medical consultations, and companies with available conditions to set up platforms so that the medical institutions or facilities are able to offer online services. For such online services, they include the daily medical consultation services for the general public, and also for the medical consultation services for chronic disease patients. So the online and offline services are integrated to provide medical services to the patients. Also, we have fever patients. They may not always be the COVID-19 patients, but they have the fever symptoms, so they can use the internet to inquire. Such online services prevented the potential gathering of fever patients in the clinics. So the online and offline medical services enable the general public to gain access to the highly efficient and effective consultation services, and also avoid the potential crowding in the clinics. All the provinces have accumulated some useful experience. For example, in Shanghai, there is an online consultation platform offering relevant services, especially services for fever patients. Also, for patients with fever, their medical needs can be satisfied by gaining access to such online services. Also, in Zhejiang, a relevant platform and channel was quickly established, so patients can enjoy such online services. Furthermore, patients can be guided by such online services to gain access to the offline clinical services. It is found that with the online services, the fever clinic visits were reduced by 50%. For the epicenter, Hubei, the online medical services are also strengthened. For the daily medical services, especially those provided to the NCD patients, such online medical consultation services are provided. So with these approaches or measures, the medical needs of the patients are satisfied, the potential crowding in the clinics are avoided. Of course, we also wish to remind the local health authorities to strengthen the regulation over such online services. Let's continue on the left, on the fourth row, the second reporter there. From China Media Group, recently, some localities like Shanghai worked out policy documents requesting the use of TCM approaches. So what's the role of TCM in the recovering patients, and what are the effects of the TCM therapies? Madam Wang, to answer your question. As you know, since ancient times, TCM has emphasized prevention and protection. This involves recovery and the prevention of the relapses. It's a good epitome of the prevention first principle of TCM. TCM has accumulated a lot of useful experience in prevention and treatment. Now we have over 30,000 patients cured and discharged from hospitals. Not long ago, we had a survey finding that though the patients are discharged from hospitals, they are still recovering their organ functions, especially for the critically ill cases. So these severe cases may have some sequelae like the fibrillation of the lung. So during the convalescence period, it is necessary to improve the outcome, which will have a better prognosis for the patients. That's why the joint prevention and control mechanism, in particular the medical expert team in this mechanism, has worked on the technical guideline for using TCM to accelerate the recovery. TCM experts have proposed various ways, offering a lot of options or set options based on the needs of the patients. Specifically, you may find drug, life support, psychological support, physical exercises, as well as traditional TCM exercises or approaches like body exercises. So with these approaches, recovery can be realized as early as possible, and the potential sequelae can be prevented. In terms of the therapies, the TCM therapies, they are consistent with the sixth version of the diagnosis and treatment guideline in terms of the staging and the adoption of the therapies. Patients in recovery can also take some prepared TCM medicines to make it convenient for them. Also, for TCM appropriate approaches, they actually refer to not only the medication but also the familiar TCM approaches like acupuncture and moxibustion. By these approaches, the functions can be quickly restored.
Also, the massage along the bloodlines and the meridians, and also the moxibustion and acupuncture on the important places along the ears, and these mirrors have been proven effective for the convalescent patients. Most of these mirrors have something to do with the meridians and the bloodlines. So we've emphasized the selection of the meridians along which the massage can be exercised. And we emphasize that these must be conducted guided by the Chinese traditional medicine physicians. In Shanghai and in Wuhan, specific recommendations were also made. In Wuhan, there is the management mirrors and a notice on isolated and quarantined places to be selected where rehabilitation TCM exercises can be conducted, so as to ensure orderly and standardized methods to be conducted, thus safeguarding the rights and interests of the patients in Beijing, Guangzhou, Shenyang, Fuzhou. Similar efforts have been made. I think the earlier, the better for the prognosis of patients. Thank you. Next question, please. From 健康报, JKB. Shortly before, there was a news that have caught the attention from across the general public. Epilepsy patients and patients with psychological disorders faced the difficulty of insufficiency in drug administration. So while we continue with the prevention control of the epidemic in Hubei, how can we ensure the parallel emphasis on the treatment of these chronic diseases? Yes, as you have rightly pointed out, since the outbreak of the epidemic, the entire national medical system have been mobilized and brought together for the prevention and the treatment of the disease. And in these efforts, we've mobilized 42,000 medical staff from across the country, including Xinjiang Production Construction Corp, to help Wuhan. And they played an essential role in the treatment of the patients. On top of our analysis of the epidemic, we also proposed the importance of prioritization, classified management, holistic deployment, and a risk-rated zoned approach. Provinces will do the zoning around the high-risk, moderate-risk, and low-risk zones, and in the high-risk zones such as Wuhan and Hubei province, priority should be placed on the prevention of further transmission and the treatment of existing patients. Meanwhile, oncology diseases and other chronic patients which need long-term and sustained treatment such as dialysis should be given equal attention to, and also pregnant and maternal women, the elder citizens with underlying diseases, and the emergency department services. All these must be maintained. Hubei province has provided a list of hospitals where chronic patients can continue to seek services. They've also provided a list where maternal women with COVID-19 infection can get delivery services. And all these are to ensure the sustained and long-term needs of the patients can be satisfied. And for moderate risk zones and regions, as we work to ensure a good job can be done in prevention control, we also incrementally and step by step recovering our services. And we are also shifting the hospital service focus to the daily and routine services. And for low-risk regions, we require comprehensive and rapid recovery of the daily routine health services to satisfy the needs of the general public. In general, we are working in a parallel fashion. On one hand, we continue to prevent and control the epidemic. On the other hand, we ensure the daily and routine medical needs of the general public can be met. And for the routine outpatient service and other services cannot be closed. Thank you. Last two questions. Journalist from the fifth row on the left side. Thank you. Daily economic news. The treatment guidance has been upgraded to the 6th edition. At the early stage of the outbreak, we focused on treatment. As the situation improves, should we include the function assessment and the signals of early recovery so as to better guide clinical practices? I'd like to ask Madam Guo Yanhong from National Health Commission to take the question. Thank you for your question. The COVID-19 is a new virus and the disease is an emerging infectious disease. Our understanding of the new virus and new disease has been improving. And in clinical practices, we've been accumulating experiences. Science and research are ongoing to make breakthroughs. Our diagnosis and treatment guidance is in its 6th edition. From early February till now, this guideline has been in the process of continuous upgrading with the purpose of integrating the proven treatment skills, treatment strategies, and methods into the guidance so as to better guide clinical practices and improve treatment efficacy. Currently, we are working to further revise the 6th edition before we introduce the 7th edition. And in this revision, we will, as we previously did, include etiological research studies, newly identified proven methods, newly identified effective medicines, and also, as you have mentioned, proven effective rehabilitation services, so that the newly updated version will help us to promote treatment as well as improve rehabilitation. Thank you. Last question, please. Journalist from the 5th row from the left side. From China Education TV, CETV. In the treatment of the severe patients, proactive measures have been adopted. What were those specific measures? I'd like to ask Director Wang Guiqiang from number 1 hospital affiliated to Peking University to take the question. Thank you for your question. The treatment of severe patients is crucial in reducing fatality rate, because severe patients may progress into gravely ill patients and may finally lead to death. We've adopted measures on 2 fronts. First, in case management, as Inspector Guo has mentioned, we have an array of treatment guidances, and we have been updating the guidances to guide clinical practices. Second, we've organized experts panels for field guidance and consultation, and also the online consultation among the experts. On the second front of the specific measures we've adopted, to put it simple, we still emphasize early identification, intervention and treatment to rein in the progression of the disease into severe cases. And for severe cases, we adopt early intervention to prevent it from progressing into gravely ill stage.
Previously, as there were quite a large number of patients, sometimes we couldn't have sufficient time to treat them. But now the situation has improved. The patients are categorized into different groups, and they can receive appropriate treatment. Then the appropriate treatment can prevent the progression of the disease. Also, we emphasize comprehensive treatment. This is an emerging infectious disease, and deficiency in oxygen has caused many severe consequences. That's why we emphasized the oxygen support. Also, we try to prevent the complications and protect the various important organs, especially for the elderly people who have underlying diseases. Then, affected by oxygen deficiency, the underlying diseases may get worse. So the protection and maintenance of the important organs are critical. Thirdly, we emphasize early intervention. Now, with clinical discoveries, we did find many indicators or parameters which could be used as guidance or guiding indicators for intervention. For example, the gradual reduction of the leukocytes, the inflammation indicators, rapid progression, and the imaging results, and etc. So they are all indicators for potential worsening, so we can use the indicators to have early intervention. Furthermore, we have new technologies and therapies available. Now, with the updates of the clinical guideline, we have integrated such therapies like convalescent plasma, antiviral therapies, and etc. are all integrated into the new guideline. So with the adoption of the new technologies and the therapies, we wish to reduce the case fatality rate and improve the clinical outcome. Also, based on the studies concerning the pathology or pathological autopsy and the further analysis of the death cases, for various death causes, we have all looked into them and worked out potential solutions to avoid such risk factors, like the use of the antibacterials or antifungus, and also the efficient or effective nebulizing approach. We wish to effectively reduce the case fatality rate and improve the cure rate. Thank you. That's all for today's Q&A. Now we will have an expert to give us health knowledge. Let's have Dr. Xie Yuxiao. Thank you. Let me answer a few questions related with recovery. The first question is, for the recovered patients, how can they have body exercises? And for the recovered patients, they need to follow the 14-day medical observation requirement. And then based on that, in the light of their health conditions, they can conduct health interventions like body exercises. Such approaches are mainly about their physical activities and psychological support. So based on their previous habits or practices, they can be gradually recovered with their previous body exercises or physical activities. For some recovered patients, they may still have some symptoms like weakness and also some respiratory symptoms. And if they have underlying conditions, then doctors from different departments should work together to come up with an appropriate recovery plan or rehabilitation plan for the particular patient. We need to work out a detailed physical activity plan and gradually increase the physical activity duration. For oxygen contained exercises, we will have a step-by-step approach. For example, we can start with 3 to 5 minutes physical activity and 3 times a day. Then on the second week, maybe we can extend the activity time to 10 minutes for each section. And we can observe the particular person if he can sustain such physical activity. On the second day of the physical activity, he should be feeling comfortable instead of fatigue. And the second question is about for patients who may not find it convenient to visit the doctors after the recovery. So for such patients, while staying at home, they can gradually increase their physical activity, like try to have a short walk at home and do not always lie on the bed. For patients with cardiovascular disease or other chronic diseases, the physical activities should be kept within the common range, and they can change a little bit their activities. For example, they can have the physical activities at home. We do not advocate the sudden increase of physical activity, as this may increase the risk of falling or injury. For patients who have suffered stroke and who are paralyzed on bed, then with the help of their family members, they can gradually stand up. If they can stand up, let's set the goal as 30 minutes standing, be it passive or active standing. Also, without family members' help, if the patient wishes to have a short walk at home, then he or she must use some support, like the stairs or the handles fixed on the wall. And also for patients suffered bone fracture, then it must be ensured the fixed support. And also use the sound part, like the good leg, to have the standing or short walk. Research has found that you should not always stay in bed, because this will make the situation worse. For patients who have difficulties in swallowing, they are faced with a high risk of suffocation. So for such patients, they should try to sit up. They can have pillows on the back to support their sitting, and also use small spoons to take food little by little. Okay, thank you for the speakers. Today's press conference has sent us a very encouraging message. By the end of yesterday, about 40,000 patients are cured and discharged from hospitals.
很多人
And many of the recovered patients have selected one thing, that is to donate their plasma to help more people to recover. We wait for the spring blossoms, which might be the season we see the recovery of all the patients. We also hope all our heroes and medical staff can come back safely home. Tomorrow we will focus on the prevention against importation from overseas. With that, we conclude today's press conference, and thank you.